Good day. My name is Imelda Williams. I'm the UC and Chief Examiner for RAD5108, 5109. And I also wish to acknowledge Tony Smith, who is the sessional that also teaches into this unit. Monash recognizes that its Australian campuses are located on the unceded lands of the people of the Kulin Nations and pays its respects to their elders past and present. So RAD 5109 is the unit concerned with the lower limbs, so pelvis and lower limbs, and then also the thoracic and lumbar spine. It's best to contact either myself or Tony via email, and I've given you our email addresses there. So all of the resources will be available on the Moodle site. So the Moodle book and also this recording will be available under the introduction week, which is starting on the 28th of July. And then, of course, as you compile your clinical portfolio, you will use information from other applicable Moodle books. The introduction presentation is also available under this week. The clinical portfolio has a competency hurdle. What that means is you must pass this unit with a minimum of 50%. If you do not achieve 50% at first instance, you will be given a second opportunity to resubmit your clinical portfolio, and that will then be capped at 50%. The overall weighting for the clinical portfolio is 30%, so it's quite a significant weighting that contributes to the overall assessment of RAD 5109. With the clinical portfolio, you will need to assemble 25 clinical cases, and I'll give you more information on the next slides. And then also the second part of it is to work out a self-auditing PIE record. The deadline for the submission of the clinical portfolio is the 19th of November. So as mentioned, you need to compile 25 cases and include all of the body regions. So from the pelvis, looking for the femur, the knee, the lower leg, the ankle and the foot. And then, of course, also the thoracic and lumbar spine. The overall word count for the clinical case report is 2,000 words, so around about 80 words per case. However, don't fret too much about that because some of your cases will be more than 80 and some will be less than 80. And as mentioned, these are the body regions that you need to include. It's really important that you also include normal as well as abnormal cases because you are going to work out your sensitivity and specificity. And for specificity, if you have very few normal cases, it can affect your specificity rate. As this is an assessment that requires your knowledge, generative AI is not allowed. So in the clinical case, include clinical signs or symptoms, or if there's an injury, the mechanism of injury, and you must include at least one de-identified image, and then write up a preliminary image evaluation without looking at a radiologist's report. And once you've done that, compare it to the radiologist's report. Not necessary, but if applicable, you can mention the patient management. You can also include references, but it is not a requirement to support your discussion. So this is the marking rubric for RAD 5109. So we've got the symptoms there. Apply the ABC search strategy as you evaluate the images. However, you don't need to comment on each of the ABCs. So for example, if you are referring to, say, for example, a foot and there is a fracture, you can mention the bone, you can mention if there's any displacement, and if there's any soft tissue signs, but you don't need to go through all of that. And then once you've done that, compare your preliminary image evaluation to that of the radiologist's report. And then don't forget your de-identified images. So each of the case will be a maximum of 4 marks. The total marks for the clinical case report is 100. Here's an example of how you can write this up. And I would really encourage you to use this example. So please remember to number your cases from 1 to 25 consecutively, and then identify the body region. But I would advise you, if you have, for example, an ankle and a foot on the same patient, write it up as separate cases, because it becomes very tricky when you have to work out your results. So that's the clinical indications, and then the images that needs to be included. And then with this PIE, was written that there's a Salter-Harris 4 fracture of the left medial malleolus, and there's an anterior teardrop sign indicating joint effusion with significant soft tissue swelling. So the radiologist's report was mainly consistent with the PIE. However, the radiographer incorrectly indicated that the medial malleolus fracture was a Salter-Harris type 4, whereas the radiologist's report stated it as a Salter-Harris type 3. So there's a false positive there. So overall, for true positive, 0.67, so about 3/4 of the report is correct, and then the false positive of 0.33. Your self-auditing PIE record then will then be a compilation of the 25 reports that we've written. So that's the body regions that must be included. And remember, normal and abnormal cases. So when you write up your PIE report, consider the clinical question. If it's a question related to trauma, then you only need to compare the PIE findings relevant to the clinical question. Remember, quite often the radiologist might add some more detail which is not related to the indication for trauma. And it could be some chronic changes that the radiologists have identified and that you can ignore. And then assign whether it's true positive, meaning that your findings match 100% with that of the radiologist in terms of the pathology, and true negative, whether it's a normal case, and then false positive or false negative. You might need to assign fractions. For example, if there's 2 fractures, you only mention 1, then you assign half. So you've only identified half of the pathology, and the other half will be false negative. Do remember, each case cannot be more, must be equal to 1. And then you calculate your sensitivity, specificity, and accuracy. And the sensitivity will indicate how well you are in identified pathology. Specificity is how well you can exclude pathology, so identifying it as a normal case. And the accuracy will then be your overall accuracy with your true negative and true positive combined over the 25 cases. You then also need to write up a reflection on your PIE abilities. And you could mention there, for example, you struggle to identify, for example, soft tissue signs that's relevant. So say, for example, if the patient has got soft tissue that indicates that this is an open fracture and that has not been identified, for example. So those are the things you can write. Also, if you have a specific body area where you still struggle with that. So say, for example, with thoracic spine, and then write also in your report how you're going to use what you've learned through the clinical portfolio. How are you going to use that to improve your clinical placement where you're working, whether you share the knowledge that you've used here or whether it's going to help you and improve when it comes to identifying image interpretation of these regions. So the allocation there, and then summarize in the proposed spreadsheet, which looks like this. So you'll have your thoracic spine, lumbar spine, pelvic region, all the body regions, and you will add more rows to that. So remember, if you have got 1 spine case, if you add this row up, it must only be equal to 1. And for each of the other 25 cases, all across should be equal to 1. And then when you've got your 25 cases, when you add this row up, it should be equal to 25 as well. This is called a decision-making 2x2 table. So it's basically comparing the gold standard, which is the radiologist report, against that of a PIE report. And there it shows positive findings, which is true positive, or false positive, and the negative would be true negative or false negative. So sensitivity then, as mentioned, identifies how well you are picking up abnormal cases. And you want to get that as close as possible to 100% so that you don't incorrectly miss out on pathology. So you should have a few false negatives. With specificity, again, this is now picking up most of the normals. And again, you want to get it as close as possible to 100% with very, very few false positive. And remember, if you overcall on normal cases, there is always the risk that it can result in unnecessary treatment. For example, if you work in a facility where there is no radiologist on site, and your opinion could be highly valued, and they could actually act according to what you have conveyed. So with accuracy then, this is looking overall at both how well you are on picking up normals and abnormals over the number of cases. So in summary then, ensure that you collect a range of clinical cases. If you do struggle with certain body areas to get those cases, please contact us. And then remember, you need to include normal cases as well as abnormal cases, and always feel free to contact us if needed. And then remember, the deadline is on the 19th of November at 5 to 12 in the evening. Good luck.